Today at Jackson Purchase Medical Center, and we're joined with Bo Page. He's the Director of Emergency Services, and as you can see, we're in a room that nobody really wants to find themselves in. Bo, we appreciate you taking some time for us today. So talk to us a little bit about if we find ourselves in the emergency room with chest pains or something similar. We're here, we're worried. What does that look like on your end?
So the first step with chest pain, first we're a chest pain accredited facility, so we really thrive with that. We really know what to do with it. The first step would be triage, and whether it's in the patient's room or in the triage room, we'll take care of you, a nurse will screen you, bring you back, and then a doctor or a nurse practitioner will come and see you and evaluate you again.
And what do the symptoms look like that would bring us here? Like, how do we know if it's not just something like indigestion, or how do we know that we need to come to the ER?
So that's a great question, and with chest pain with a heart attack, there's a lot of different symptoms to that. You could have some indigestion, you could have some nausea, you could have some sweating, you could have some shortness of breath or just general fatigue, and those are the early signs. We always think of that crushing chest pain, that pressure, but it could be much milder than that, and it's important to go get those things checked out. You could have pain to your shoulder or to your neck, and those are all early signs and symptoms of a heart attack. So those are things that we really need to be proactive with and get checked out as soon as possible.
So the important keys are if we don't feel right and those feelings persist, are those different in men versus women?
So they absolutely are. Men generally have we call it the typical signs of chest pain, which is the crushing chest pain to the middle of the chest, maybe sudden shortness of breath. Women are much different with that. They'll often have just indigestion or nausea, and because of that, a lot of women's heart attacks go undetected until it's too late when there's already damage there. So there's more of a mortality rate for women than there are with men with heart attacks.
It's probably best to talk with our partner if we're feeling something like that and keep a watch on it, right?
So no, you need to go see someone right away when you have those symptoms. Okay. So you would want to get checked out as soon as possible. Don't wait, don't rest. Don't just think, oh, it's just stress, it's going to get better, because stress can also cause a heart attack. So it's important to get screened immediately, as soon as possible. Call 911 or take your loved one to an emergency department.
I know sometimes people don't want to bother the doctor or go to the ER, but it's not about being a bother. Is that right?
We want you to come. We want to help you. So we want you to come and see us so we can take care of it. And hopefully it's not a heart attack, and then we can take care of it then.
Okay, we're going to take a short break, and we'll be right back with more questions.